Potassium deficiency is basically if the potassium levels in the blood are below 3.5 milliequals per liter. So that is called as moderate to mild hypokalemia. It can also go to severe hypokalemia, which is less than 2.5 milliequals, which can be life-threatening. So less amount of potassium in blood is called as potassium deficiency, which is 3.5 or lesser. And in other words, we call it hypokalemia in medical language. Potassium is a very important mineral in the body, which is required for all the important functions. Now, be it brain, heart, muscles, nerves, everything for proper functioning requires potassium because all the channels, all the receptor channels on cells require potassium and sodium as their for exchange of information. So thereby potassium is a very, very important mineral without which there can be severe weakness. Life is actually just not possible if without potassium. Potassium deficiency hardly occurs in normal scenarios, but however, there are the symptoms that are present are generally of the underlying cause, which is excessive fluid loss. However, we can watch out for generalized weakness, fatigability, excessive muscle cramps. It can also cause psychological issues such as hallucinations, delirium, psychosis, and there can also be cardiac symptoms such as palpitations and difficulty, chest pains, etc. But it starts off basically with excessive vomiting or diarrhea. Those are generally the common symptoms that one sees in practice, which leads to generalized weakness and muscle cramps. Potassium deficiency is specifically caused due to excessive excretion of potassium due to fluid loss. It can also be due to other reasons, but the commonest ones are due to excessive fluid loss, such as sweating, excessive diarrhea, vomiting, or it can be due to use of diuretics for certain liver or kidney conditions. It can be due to excessive use of laxatives. It can also be due to certain medications that are given by doctors, such as ampicillin, certain antibiotics. And there are also genetic conditions which cause increased excretion of potassium through the kidneys, but these are very rare. Yes. The commonest ones are due to diarrhea and vomiting and excessive sweating. There are very simple tests. One is a blood potassium level, also called, like we generally do it with serum electrolytes. So it can be measured in blood and in urine. There are spot tests available as well, and the results of which we can get very, very quickly. So very simple tests. And along with this, we generally also do the reason for why potassium deficiency may be occurring. So potassium deficiency can be treated orally with the use of potassium chloride, and also in cases of severe potassium deficiencies, we can also use injectable potassium chloride. There are other forms available as well, but potassium chloride is the safest and the most commonest form of treatment that we use. Potassium deficiency, very rarely do we come across where it's left untreated, because if left untreated and if severe, it results in life-threatening consequences. However, there are certain conditions in which we can expect chronic deficiency, such as liver patients, patients who are on diuretics, patients who are diabetic and have very high uncontrolled sugars. So in those patients, or patients who have diarrhea or excessive vomiting, so dietary potassium is generally not enough when there is an underlying condition, and potassium can be supplemented by various methods. There's potassium chloride, potassium biphosphonates, potassium carbonate. The commonest we use is oral potassium chloride in case supplementation is required. People at a risk of potassium deficiency generally are counseled about it by their medical team. Now, first and most important thing is have a balanced and a good diet, which includes legumes, good amount of fruits, vegetables, whole grains. And if at all there is still excessive washout of potassium, supplementation on time. Now, whenever a patient is kept on potassium supplements, it is imperative that they undergo periodic analysis for the same, because potassium toxicity is also, that is, increased potassium levels can be very toxic for the body as well and life-threatening too. So it has to have a very proper balance. For regular people who do not have any underlying causes, generally potassium deficiency will occur in cases of fluid loss such as vomiting, diarrhea, or sweating. In those times, ORS or electrolyte powder is enough to help them replenish the stores. Most foods that we eat contain potassium. Since it is a very important mineral, nature has inculcated in everything that we eat. However, if you talk about potassium-rich foods, legumes, most common fruits and vegetables such as banana, oranges, apple, even cucumbers, zucchini, arugula, kale, all of these contain potassium in good amounts. Even your dairy products such as milk and yogurt, chicken, meat, salmon, cod, all of these contain good amount of potassium. So dietary potassium is generally met with your regular food.